Natalie Ray here with Aesthetics Concierge of Texas, and today we are going to unpack everything you need to know about the P-Shot, P-Tox, also known as Bocox, Scrotox, and exosomes for men's sexual health. Erectile dysfunction. The P-Shot with exosomes, and P-Tox are treatments for erectile dysfunction. Before we dive into how these work, let's discuss the physiology of erections and the pathophysiology of erectile dysfunction. Here we have the base, shaft, glands, and urethral opening of the penis. Inside the shaft of the penis are two chambers filled with blood vessels and nerve tissue named the corpus cavernosum. Following sexual stimulation, neurotransmitters are released from the cavernosa nerves, which cause arterial dilation and venous occlusion. An erection happens and is sustained when the blood vessels of corpus cavernosum fill with and hold blood. Now that we understand erections are a function of properly functioning blood vessels and nervous tissue, we can unpack how the P-Shot with exosomes and P-Tox work to treat erectile dysfunction. The P-Shot procedure utilizes the growth factors and platelet-rich fibrin to stimulate tissue regeneration and improve blood flow in the penis. At Regen and Aesthetics Concierge of Texas, we combine the first P-Shot with exosomes. Exosomes are cell signalers which signal the messenger RNA in your growth factors to promote optimal functioning. Growth factors in PRF include IGF, PD, EGF, PDGF, TGF, VEGF, and BFGF. These growth factors are responsible for rebuilding healthy vascular and nerve tissue in the corpus cavernosum of the penis and glands, thereby improving erectile function and sensitivity. The P-Shot procedure. So for step one, when we bring you into the office, we'll first apply prescription strength numbing cream to the areas to be treated. Step two, we'll draw your blood and centrifuge it to produce the PRF or growth factor layer of your blood. In step three, the PRF is mixed with exosomes and potentially P-Tox, which we'll get into in a moment. And this mixture is injected into the penis, specifically into the corpus cavernosa. Full results from the P-Shot are seen in 10 to 12 weeks, and depending on baseline function, a series of 3 P-Shots may be needed for optimal results. Now we'll unpack P-Tox, also known as Bocox. 100 units of Botox is injected into the corpus cavernosum in divided doses for even distribution. Botox affects the neurotransmitters of the cavernosum, leading to greater arterial dilation and venous occlusion with erections. Clinical data supports repeating P-Tox or Bocox every 6 months. Prescription strength numbing cream is applied before the procedure, and the injections are typically very well tolerated. Now we'll unpack Scrotox. When administered in the scrotal region, Botox induces the relaxation of both the cremasteric muscle, which is responsible for controlling the height of the testicles, and the dartos muscle, a layer of muscle beneath the skin of the scrotum that regulates its size. The injection of Botox into these muscles leads to a noticeable descent of both the scrotum and the testicles. Indications for Scrotox include aesthetic or cosmetic improvement, as well as relaxation of a hyperdynamic or hyperactive scrotum. Prescription strength numbing cream is applied before the procedure, and the injections are typically very well tolerated. That's a wrap for our overview of the P-Shot, P-Tox, and Scrotox. If you live in the Dallas-Fort Worth area, use the link in the description of this video to book a free in-person or virtual consultation with us. I hope this guide helped you better understand the many ways these treatments can benefit you, and I'll see you in the next one.